Acute Care Nurse Assistant, Module 7, Renal Care. Content 1, Basic Terminology. Content 2, the basic anatomy and physiology of the urinary system. Anatomy: kidney, ureters, bladder, urethra. The basic anatomy and physiology of the urinary system. Functions: waste elimination, fluid and electrolyte balance. Content 3, procedures and nursing care used for the genitourinary system. Personal hygiene, perineal care, catheter care, accurate intake and output, bladder training, with catheter, without catheter, urinary problems, kidney stones, strain urine, report pain, AV shunt, fistula, no BP in that arm, renal failure, with catheter, without catheter, dietary and fluid restrictions, daily weights, urinary incontinence, skin care, protective pads. Content 4, age-specific toileting behavior, adolescent, young adult, adult, and elderly. Identify age-specific issues. Adolescent and young adult, more aware of body changes, embarrassed easily, provide privacy. Adult, independent, establishing family and career, allow independent choices, assist as needed. Elderly, often have incontinence, embarrassment, provide privacy, need more assistance. Content 5, the reportable signs associated with urinary system. Urine characteristics: color, clarity, odor, amount, normal and abnormal. Intake and output. Report signs and symptoms: urgency, frequency, bladder pressure, burning or difficulty urinating, decreased amount or lack of urine. Content 6, the various urinary drainage tubes and the nurse assistant role. Foley catheter, condom catheter, nephrostomy tubes, continuous bladder irrigation, suprapubic catheters, leg bag. Content 7, the difference in care measures between hemodialysis and peritoneal dialysis. Hemodialysis, procedure that filters and cleans waste products from the blood. It is performed by specially trained RNs. Never take blood pressure in arm with a fistula or a shunt. Peritoneal dialysis removes extra water, waste, and chemicals from the body by perfusing sterile solutions through the peritoneal cavity and using the thin membrane that lines the abdominal organs, peritoneum, as a filter. The dialyzed solution drains out through an abdominal tube. Reporting abnormal signs and symptoms such as fever, nausea and vomiting, abdominal pain, redness around the catheter, change in vital signs. Special considerations: no ointments or powder around peritoneal catheter, prevention of infection, and standard precautions. Content 8, the procedure for collecting urine samples. Specimen collection, clean catch midstream, 24-hour urine collection, specific gravity. Standard precautions. Follow hospital policy for procedure and specimen handling. Content 9, list diagnostic or therapeutics for urinary or renal problem. Cytoscopy, visual exam of the bladder, uses contrast medium to evaluate bladder and kidney. Intravenous pyelogram or IVP. CT scan, uses contrast medium to evaluate structural abnormalities. Lithotripsy, to break up stones. Urinalysis, blood chemistries. Renal scan, to show blood flow. Electromyography, evaluate bladder and sphincter muscles. Module 7, Evaluating Urine Color. Appearance: colorless or straw-colored, diluted urine. Excessive fluid intake, chronic renal disease, diabetes insipidus, nervous conditions. Dark yellow or amber, concentrated urine, low fluid intake. Acute febrile disease, vomiting, diarrhea. Cloudy. Infection, purulence, blood, epithelial cells, fat, colloidal particles, urites. Vegetarian diet, parasitic disease. Yellow to amber with pink sediment. Hyperuricemia or gout. Orange-red to orange-brown. Urobilinuria. Such drugs such as phenozopyridine. Obstructive jaundice, tea-colored. Red or red-brown. Porphyria. Hemoglobin. Erythrocytes. Hemorrhage. Such drugs as pervinium pomoate. Green-brown. Bile duct obstruction. Phenol poisoning. Dark brown or black. Acute glomerulonephritis. Chorea. Typhus. Methylene blue medication. Smoky. Prostatic fluid. Fat droplets. Blood. Chyle. Spermatozoa. Specimen collection. General procedure. Nursing preparation. Know which test is needed. Assemble correct equipment. Review procedure. Identify patient to be sure procedure is for right patient. Consent form if necessary. The responsibility of the RN. Obtain help if necessary, such as assisting with heavy patient to BSC or lifting equipment. Determine if any special equipment is needed, such as a wheelchair to assist to the bathroom, waterproof bedpans, etc. Preparing the patient for tests. Communication skills. Clear instructions as to right time, need for the test, what patient must do. Obtain the patient's cooperation to participate in the test. Remain NPO if necessary. Call next time need to void. Drink extra water, etc. Answer patient's questions about the test or find information. The more informed the patient, the more cooperative he or she will be. Perform the procedure. Use aseptic technique. Wash hands. Prepare the environment, such as privacy, draping, assist with positioning. Obtain the right amount of specimen in the right container at the right time from the right patient. Wear gloves if contact with body fluids. Follow standard precautions and category-specific isolation procedures. Re-establish comfort. Reposition the patient. Straighten bedding. Notify nurse of need for pain medication, etc. Delivery and documentation. Handle and label specimen correctly. May need to be refrigerated or delivered immediately to lab. Document procedure correctly, or report to nurse that specimen has been obtained. Urine specimens. Clean catch, midstream. Gather equipment. Follow general procedures. Wear gloves. Clean meatus and obtain specimen. Label specimen. Let patient wash hands. Re-establish comfort of patient. Follow general procedure. Gather equipment. Post signs with date and time of collection. Explain procedure. Save all urine. Do not contaminate urine. Void before start of test. Discard. Save all urine for 24-hour period if specimen lost or contaminated must start over. Store in proper container. Maintain on ice if necessary. Have patient void before end of time period if possible. Remove signs and tell patient test is over. Straining urine for kidney stones. Follow general procedures, understand medical process. Post signs with date and time of collection. Location of kidney stones. Pain is severe. Patient may forget to save urine. Wash hands and wear gloves. Provide collection pan for urine. Strain all urine, even if patient has catheter. Observe urine. Save any foreign material. Remove gloves and wash hands. Equipment: sterile urine specimen container, routine specimen container and lid, 24-hour urine container, condom catheter, Foley catheter, Foley drainage bag, continuous bladder irrigation setup. Criteria for collecting urine specimens: accurately obtain urine specimen in clinical area, clean catch, midstream, 24-hour. Demonstrates application of condom catheter. Demonstrates emptying and accurate measurement of urine from drainage bag. Specific gravity equipment: graduated cylinder to collect urine, urine specimen cup, urine specimen, urinometer, tissue or washcloth and towel to provide peritoneal care, and gloves. Determine specific gravity. Perform introductory procedure. Knock, introduce self, wash hands, identify patient, explain procedure, and provide privacy. Put on gloves. Obtain at least 20 cc of fresh urine specimen that is not contaminated by tissue or stool. Use bedpan or specimen pan in toilet. Be sure containers are clean. Assist patient to dry perineum. Pour urine from bedpan or specimen pan into clean graduated cylinder to measure. Pour 30 to 50 cc into specimen cup to use for ease of pouring into urinometer. Place urinometer on paper towel or on counter. Pour at least 20 cc of urine into urinometer so that it is at least 2/3 full. The base of the bulb should float and not touch the bottom. Gently spin the stem of the bulb so that it floats freely and does not touch the sides of the urinometer. Raise the urinometer to eye level or bend down to view it as it sits on the counter. At eye level, read the highest point on the urinometer scale where the urine touches the scale. The scale measures from 1 to 1.040 and is normal 1.003 to 1.030. Empty urine into toilet. Wash and rinse the cylinder using soap and water according to facility policy. Replace equipment to appropriate storage area. Wash hands. Document procedure and input and output as necessary. Report results to the licensed nurse. Thank you for your attention.